Raymond Schmidt spent his career as a letter carrier for the Postal Service.
I'm walking like 7 hours a day, pounding in and out of the truck.
After decades on his feet, Schmidt felt it in his knees.
My legs were always a little bit bowed.
Both knees were painful at night. He tried supplements and cortisone shots, but nothing gave him relief. Knee replacement was his remaining option.
Once the x-rays show bone-on-bone arthritis, which is what most of our patients will show, it means there's no more space, there's no more rubber on the tires, the bones are touching.
Orthopedic specialist Yair Kissen had new knee technology to offer, the Persona IQ Smart Knee, a knee replacement with sensors that transmit motion data. During surgery, the arthritic joint is replaced with a custom selected plastic and metal replacement and an additional stem that anchors into remaining bone.
This is basically a little addition that gives you sort of a Fitbit inside your attached to your implant.
The technology gives feedback on a patient's movement after surgery, including speed and range of motion.
This technology is based upon pacemaker technology that gets implanted in a person and stays there for 10 to 20 years.
The information can help researchers and patients monitor recovery better than ever before. Schmidt can see the difference in his left knee. He's looking forward to having his other done and getting back to the activities he loves. I'm Marty Salt reporting.